For today's appointment, we're going to be probing and exploring on your teeth. So basically, the purpose of probing is to measure your pocket depths, which is related to your gum health. And when I'm exploring, I'll be seeing if you have any calculus that would be subgingival, so under your gums, to see where that's at. So I'll be probing and exploring on the facial side of your teeth, as well as the lingual and interproximal surfaces, to make sure your pocket depths and calculus deposits are consistent throughout, I guess. The benefit of probing and exploring is to have an accurate assessment of where your overall oral health is at, as well as potentially recognizing the subgingival calculus that may not be noticed without this procedure. The risks of probing and exploring is a little bit of bleeding, maybe some slight discomfort, and irritation of the gums. The only major risk of exploring and probing is not accepting the treatment, because there's no alternative that I can do other than probing and exploring. The cost of this procedure is included in the cost of the overall appointment. Anything I find would be reviewed by the supervising clinician, and it'll probably take about 15 to 20 minutes. Did you have any other questions or concerns about the treatment?
I was just curious what it does mean if I have any calculus or deep pockets.
Okay, so if you did have deep pockets, then anything I would find would be reviewed by the clinician, and then the clinician and the dentist would come up with a treatment plan. And then if you had deep pockets, you would just have to come back for a continued treatment to try to reverse it. If you had a lot of calculus, then you would just have to, the next appointment, I would just have to scale it off. So it wouldn't be a big deal at all.
Okay. I was just confused when you were talking about the teeth. What surfaces are you working on?
Okay, so there's the facial, the lingual, and the interproximal. So the facial is the side that your cheek touches, so like the outside of it. The lingual is the inside of your teeth, so like where your tongue's at. And then interproximal is in between the teeth, so where the teeth touch.
Okay, so everything.
Yeah, so pretty well everywhere other than like the biting surface of your teeth.
Oh, okay, cool.
Okay.